Good morning. Welcome to Anatomy of Thorax, Lecture 5. The objectives of our lecture is to identify the bronchopulmonary segments, the anatomy of the lobes of the lung, its blood supply, innervation, and lymphatic drainage, to describe the surface anatomy of the pleura and lungs, and to describe the costodiaphragmatic pleural recesses and other recesses of the pleura. The bronchopulmonary segments. What are the bronchopulmonary segments? These are anatomical, functional, and even surgical units in the lungs. You remember in the last lecture when I said that the trachea, when it ends, it will be divided into right primary or main bronchus and left main bronchus. Each in the right side, the right bronchus, it will be divided into just before it enters to the hilum of the lung into superior lobar bronchus or arterial bronchus, and when it enters to the root of the lung, it will be divided into middle and inferior lobar bronchi. And in the left side, there is only superior and inferior lobar bronchi. So these bronchi are the secondaries. These are the secondaries bronchi or secondary bronchus. So these secondaries, when it enter more into the lung lobe, into the lobes of the lung, they will undergo further divisions, more divisions. So the primary will be divided into secondary to give the secondary bronchi divided more to give the segmental or the tertiary bronchus. So the bronchopulmonary segment, it is a segment, it is subdivision in the lung lobe. It is structurally and functionally independent unit of the lung tissue or lung lobe or lung parenchyma. هي جزء من اللوب، هي subdivision من اللوب of the lung, but it is structurally and functionally independent. زين، ليش independent؟ ليش إيش بيها؟ It contain what? It contain the segmental bronchus أو اللي هو tertiary bronchus with a branch of pulmonary artery. بعد tributaries of pulmonary veins همين موجود running in the connective tissue between the adjacent bronchopulmonary segments. The bronchopulmonary segment تكون triangular in shape and it is surrounded by connective tissue. والpulmonary vein, tributary of pulmonary vein, it runs in the connective tissue between the adjacents المتجاورة اللي هي bronchopulmonary segments. بعد branch من pulmonary artery, as I said. Then what else? Each segment has its own lymphatic vessels and autonomic innervation. That's why I said it is structurally and functionally independent unit. The bronchopulmonary segment, as I said, it contains the tertiary bronchus or segmental bronchus. هذا بعد راح يصير بينه divisions, more divisions. It will give rise to the bronchioles. يعني bronchial tree تبدأ بالبرونكاي, primary, main bronchus, primary, secondary, tertiary, more and more divisions as we go distal in the bronchial tree. بعدين يبدأ يظهر لنا structure اسمه bronchioles. Bronchioles, they are different from the bronchus, bronchi or bronchi. And how is that? Bronchioles are less than 1 millimeter in diameter. ما بس السايز but their walls lacking the cartilage. ما بينه cartilage. There is no cartilage in the bronchioles. يعني أنا من أحكي عن bronchi, primary, secondary, tertiary, all of them they contain cartilage in their wall, but the bronchioles they lack the cartilage in their walls. In addition, they are less than 1 millimeter in diameter. زين. Bronchioles they will divide more, giving rise to the terminal bronchioles. Terminal bronchioles, more divisions, giving origin to the respiratory bronchioles. طبعا as we go distally, the respiratory epithelium, this structure, the epithelium is going to be simpler. So terminal bronchioles, more divisions, respiratory bronchioles. These respiratory bronchioles, they will open into the alveolar ducts. The alveolar ducts will end to alveolar sacs. And what are the alveolar sacs? They are the sites of the gaseous exchange, a blood-air exchange, the site of the gaseous exchange. So, if we want to understand the bronchopulmonary segments in the right lung and left lung, try to understand the bronchopulmonary segments. مثلا واحد يسأل, what are the bronchopulmonary segments in the right lung? As this slide shows, in the right lung we have superior lobe, middle lobe, and inferior lobe. The superior lobe, it has apical, anterior, and posterior segments. This is the superior lobe. وهذا الميدل lobe, the medial, بينه medial and lateral. This in هذا الموجود بالسلايد, purple color, the middle lobe, lateral and medial. The lower lobe is the inferior lobe. Inferior lobe. زين ايش راح يكون بينه؟ بينه superior أو نسمينه بعض الأحيان apical. بينه medial basal و lateral basal. بينه anterior basal and posterior basal. فبينه anterior posterior, medial and lateral basal bronchopulmonary segments. This is for the right lung. What about the left lung? The left lung, as you know, only we have superior lobe and inferior lobe. في superior lobe ايش راح يظهر بينه؟ apical والanterior posterior segments, in addition to the superior lingular and inferior lingular. Superior and inferior lingular segments. This is for the superior lobe. What about the inferior lobe? The inferior lobe عندنا السوبيريور أو نفسه هو apical ممكن أو superior بعض المصادر. Medial basal و lateral basal, anterior basal و posterior basal. إذن بينه superior or apical, in addition to medial و lateral و anterior و posterior basal pulmonary segments, so bronchopulmonary segments. And this is for the left lung. So to understand the bronchopulmonary segments, these are some main characteristics of the bronchopulmonary segments. So it is subdivision of the lung lobe, as I mentioned. It is pyramidal in shape and the apex is toward the lung root, as the previous slide shows. So it is pyramidal in shape and the apex is toward the lung root. It is surrounded by connective tissue. وذكرنا إنه tributaries of the pulmonary vein runs in this connective tissue between the adjacent bronchopulmonary segments. It contains what? It has what? Contain what? Segmental bronchus, segmental artery, lymphatic vessels, and autonomic innervation, which are independent of other segments. And the segmental vein lie in the connective tissue, as I said, the bronchopulmonary segments in the adjacent connective tissue. It can be removed surgically. يعني يجي الجراح ممكن يقدر أن يشيل segment of the in the lobe of the lung. It is structurally يعني and functionally independent، فممكن يشيلها بدون خوف، ما راح تأثر على البرونكوبulmonary segment أو النكست أو الادجacent bronchopulmonary segments. يشيلها ممكن it can be surgically removed by segments because it is independent, as I said, independent units. If you look to the root of the lung, as I said, what is the root of the lung? It is the site of entry and exit of structures that enter to the lung, leaving the lung. Then, like what? The bronchi, pulmonary artery, pulmonary veins, lymphatics, bronchial arteries and veins, in addition to the innervation. يعني بالنسبة للروot of the right lung and left lung يعني they are the same، نفس structures. It will enter and leave the lung. And as I said, the root of the lung or the hilum نفس الشيء will be surrounded by cuff of the pleura اللي هو union of the visceral and parietal pleura, it forming they unite with each other, forming cuff of a pleura. And this will hang down around the root of the lung, and this will hang down, forming the pulmonary ligament, as this slide showed, to facilitate movement of these structures in this very important area. The blood supply of the lung is through the bronchial arteries, and you remember that the bronchial arteries arises from the descending thoracic aorta. And what about the venous drainage? The bronchial veins will drain to azygous and hemiazygous vein. And don't forget that we have two pulmonary veins in the right lung and two pulmonary veins in the left lung, and the four pulmonary veins, right? That carry the oxygenated blood from the lung, leaving the lung root and enter to the left atrium, carrying the oxygenated blood. Lymphatic drainage of the lung. We have two plexuses, the superficial plexus and the deep plexus. Superficial أو يسموها subpleural because it is just underneath the visceral pleura. And you remember that the visceral pleura is adherent to the lung tissue. So the superficial plexus is just underneath the visceral pleura. So it drains the superficial part of the lung, drains the surface of the lung, and it drains into the hilum where the bronchopulmonary lymph nodes are there. So the bronchopulmonary lymph nodes are at the root of the lung, as you see here in this slide. This is for the superficial plexus. What about the deep plexus? The deep plexus, they runs through the bronchi and pulmonary vessels throughout the lung tissue or inside the lung tissue or inside the parenchyma. عندنا bronchi و pulmonary vessels. وعلى طول هاي البرونكاي pulmonary vessels distributed many pulmonary lymph nodes. So they drain the substance of the lung or the lung tissue, the parenchyma of the lung, inside the lung tissue. Ends in the hilum. When it drains to what? Just like the superficial, it ends to the bronchopulmonary lymph node at the root of the lung. بعدين later the bronchopulmonary lymph node will end into the tracheobronchial lymph node, which ends into the bronchomediastinal lymph trunk, which go to the right side, the right lymphatic duct, and to the left side into the thoracic duct. So the lymphatic drainage of the lungs consists of the superficial plexus and the deep plexus. What about the innervation of the lung? Innervation of the lung is through the pulmonary plexus. There are two pulmonary plexus, anterior and posterior one. The pulmonary plexus, they contain fibers, sympathetic and parasympathetic fibers. So it has autonomic innervation, sympathetic and parasympathetic. The sympathetic innervation, it causes bronchodilation of the bronchi, dilatation of the bronchi, and vasoconstriction, constriction of the vessels, while the parasympathetic act an opposite way, that it causes bronchoconstriction or constriction of the bronchi with vasodilatation, dilatation of the vessels there. And in the parasympathetic innervation also it increases the glandular secretion. So the nerve supply of the lung is autonomic innervation, sympathetic and parasympathetic innervation through the anterior and posterior pulmonary plexuses. The surface marking of the pleura. This is actually very important. You remember the cervical part of the parietal pleura or the cervical pleura, أو بعض المصادر تسميها dome of the pleura. So it projects at the root of the lung, at the root of the neck. The root of the neck, you remember, is lined by suprapleural membrane, right? The root of the neck is lined by suprapleural membrane. فالcervical part of the pleura يغطيها من فوق الsuprapleural membrane. زين. منين راح تبدأ؟ The cervical pleura, it started at the sternoclavicular joint. Right, you remember the sternoclavicular joint between the sternum and the clavicle. There is articulation. We talked about it in the first lecture. So it starts at the sternoclavicular joint up, 1 inch up, above the junction between medial and intermediate third of the clavicle. So if you imagine that the clavicle is divided into 3/3, imagine that the clavicle is divided into 3/3. Medial third, closer to the body, intermediate third, الوسطي, and the lateral third, الأبعد. So, the cervical pleura, it extends from the sternoclavicular joint 1 inch above the sternoclavicular joint 1 inch 2.5 centimeter to the junction 1 inch above to the junction بين الميديال and intermediate third of clavicle. هذا الليفل مالته. This is the cervical pleura, cervical parietal pleura. زين. نيجي للانتيريور border. Anterior border right side is different from the anterior border بالleft lung, يعني right pleura العفو والleft parietal pleura. The anterior border of the parietal pleura in the right side extends anteriorly downward from where? From the sternoclavicular joint. رأسا تنزل downward to the sternal angle. Then it continues downward to the level of the xiphisternal joint. And you remember articulation between the xiphoid process and the sternum called xiphisternal joint. Then descend downward مباشرة from the sternoclavicular joint to the level of the sternal angle, then downward to the xiphisternal joint. This is in the right side. This is the anterior border of the parietal pleura of the right side. So, what about the anterior border of the left side or anterior border of the left lung? It descends downward نفس الشيء أيضا بدءا or starting from the sternoclavicular joint to the level of the fourth costal cartilage where it deviates laterally along the lateral margin of the sternum. هوني here is the site of the heart. فبهاي المنطقة راح تتكون الكاردياك نوتش on the lung tissue. هاي منطقة الكاردياك نوتش on lung tissue. The anterior border started from the sternoclavicular joint to the level of the fourth costal cartilage. Then it would deviate laterally. Here is the cardiac notch is formed. Then after the cardiac notch is formed, descend رأسا sharply to the level of the sixth costal cartilage. So this is the anterior border of the left lung. What about the inferior border? The inferior border, they are the same, right and left lung. So it passes downwards and laterally from the xiphisternal joint. It crosses the ribs at different lines. يعني it crosses the 8th rib at midclavicular line, the 10th rib at mid-axillary line, and the 12th rib just adjacent to the vertebral column. يعني لسهولة الحفظ 8 10 12 it crosses the ribs 8 10 12 at mid-clavicular, mid-axillary, and just adjacent to the vertebral column بالترتيب بالتسلسل. So the inferior border in the right lung and left lung are the same. What about the posterior border? Posterior border of the parietal pleura, it extends from the, you remember the dome of the pleura or the cervical pleura. So the posteriorly start from the back of the cervical pleura and it ends downward just below the neck of the last rib. Just below the neck of the last rib. This is the posterior border and they are the same in the right lung and left lung. فقط the anterior border is different between the right and left lung. The others all are the same. The surface marking of the lungs is the same as that of the parietal pleura. But what is the difference? The difference is only the inferior border. Only the inferior border of the lung surface marking is different from that of the parietal pleura. والفرق هي 2 ribs. يعني أنا قلت 8 inferior border بالparietal pleura 8 10 12. هون حتى نحفظها 6 8 هاي سهولة الحفظ 6 8 10. It crosses ونفس lines, the same lines. So it crosses the 6th rib at mid-clavicular line, the 8th rib at mid-axillary line, and the 10th rib just adjacent to the vertebral column. 6 8 12. So 2 ribs higher than the parietal pleura. Okay, so this is the surface marking of the lung is the same as the is the same as طبعا the parietal pleura. Only the difference is the inferior border, which are 2 ribs higher than the inferior border of the parietal pleura. أكو فد مصطلح named as a pleural recess. What is a pleural recess? They are gaps or small spaces. They form due to reflection of one part of parietal pleura against other part of parietal pleura. Right? You know that parietal pleura has different parts, 4 parts as I said. So reflection of one part of the parietal pleura against the other part forming these pleural recess. And what is the benefit of this recess? What is the benefit? They provide additional space for lungs to expand, especially during forced inspiration. They provide additional space for lung tissue to expand during forced inspiration. And they are three recesses in number. They are three in number. The first one, costodiaphragmatic recess, from the name. So it is a reflection of the costal part against the diaphragmatic part, right? This is the first one. The costomediastinal is the reflection of costal part against mediastinal part. The last one is the mediastinodiaphragmatic, and this is the smallest one. It is very small bit among these three recesses, and it is due to reflection of mediastinal part against the diaphragmatic part. So these are the three pleural recesses which are clinically significant, that they provide additional space for the lung to expand during forced inspiration. Also, we may expect clinically accumulation of excess of pleural fluid in these spaces, of course, in the pathological conditions. And thank you for today.